I got to a point in 2008 when I was recovering from one of my surgeries, and I realized that the cancer center where I had been being treated was actually shutting down their support groups. And I felt like this isolation and this loneliness of being on a cancer journey by yourself.
So as a person who's diagnosed in 2008, I lived in this world where people were already blogging, people were already using Facebook and Twitter and other forms of social media to connect. But it was still new, and I used it to be completely open and transparent with my friends and family.
And I had a friend that was visiting me, and she said, there's this thing called Twitter, and I'm really surprised at the number of people that are actually putting cancer survivor in their bio.
And eventually, when you're out online somewhere, through search engine optimization, people who did not know each other before their diagnosis were now able to more easily find one another through various search terms, or in time, like we see on Twitter, through hashtags.
There was something very immediate and transparent about being able to share or ask quick questions on Twitter that I thought was just so transformational. So I felt like for the first time in my life, I had found a way to connect with another person that essentially had the same cancer journey that I had.
In the early 2010s, a whole healthcare hashtag community started to emerge organically on Twitter. Actually first started with hashtag HCSM, which stands for Healthcare Social Media, which was started and run by a patient, Dana Lewis, an amazing woman living with type 1 diabetes.
In 2011, I had met another breast cancer survivor online, and we got together and we started talking about the concept of building a place where we could return to week after week that would bring the breast cancer community together. And we came up with this idea of using a hashtag to build a virtual community. We would tag our community BCSM, which stood for Breast Cancer Social Media. We'll follow the likes of what Dana Lewis had done, and we borrowed the nomenclature that she was using, which was HCSM, which stood for Healthcare Social Media.
In time, Healthcare Social Media, which is about innovation in healthcare and new technology, got co-opted by patient communities. So the breast cancer community started BCSM for Breast Cancer Social Media, and modeling themselves off after HCSM, they started hosting weekly tweet chats, kind of like old school chat rooms in the AOL days, but let's all show up at the same time, same place. We're gonna have a semi-structured conversation about issues that mean something to the breast cancer community.
We launched our first chat on July 4th, 2011. 75 people showed up. We knew at that moment we were onto something, that this was going to transform what it meant to be part of a community of breast cancer survivors. We structured it as a Twitter chat, so we meet every Monday night, 9 p.m. Eastern, for 1 hour on Twitter. It's been running nonstop on Monday nights since July 4th, 2011.
One day, a couple of years later, I stumbled across people I had been following who were using this hashtag, which I didn't understand what this acronym meant, but were talking about cancer and talking about how they were saddened that somebody they knew from the internet community had just died. And I joined this conversation like, sorry for your loss. What the hell does this hashtag mean? And people responded back, hey, BCSM stands for Breast Cancer Social Media, welcome. I said, oh, thanks for welcoming me. Yeah, I'm not a breast cancer patient. I'm actually a brain cancer patient, so I guess I can't hang out with you guys. And they're like, no, we're here for all patients. Come join us. Actually, if you're interested, you can start your own community and do the same thing. They gave me an idea. Anyone could make this up. There was another brain tumor person from the brain tumor community who was also watching this conversation. This person said, why don't we start BTSM, which could stand for Brain Tumor Social Media. I said, that's great, tonight it's born, BTSM. We have a community.
We've been able to connect patients, physicians, caregivers, researchers, all around this virtual space and provide support for patients that are going through the breast cancer journey for the very first time.
We now, since 2013, have been running a BTSM, Brain Tumor Social Media tweet chat nonstop since 2013. We meet the first Sunday of each month. We have a moderated chat for an hour. We just do it once a month. So many more people have joined us that aren't just folks living with brain tumors, but it's also the care partners, parents of kids with pediatric brain tumors.
And it's just been an absolutely amazing experience.